Hello guys, thank you very much for tuning in to the HEALTHWING. I'm your host Nicole Margaret, always here to help you stay happy, healthy and strong.
I'm Maxwell Ezekiel, and today basically tutaenda kuongelea about STIs.
Yeah, STIs.
Yes, the topic is STIs. Guys, remember to subscribe and the notification button, press that.
Yeah, leo tunaongelea STIs venye mmesikia. I know STIs, it's a wide topic. Most of you might not be knowing what we mean by STIs. So daktari, would you define STIs?
STI, initially people used to call these STDs,
Yeah.
sexually transmitted diseases. But we say it's sexually transmitted infections. And as she has said, these infections are wide. Ni mingi sana. We ain't going to cover specific STI, but we're gonna see how are these STIs transmitted, how they can be found in somebody, and how can they be treated, and how can you prevent these STIs. As I said, these are sexually transmitted infections. The mode of transmission is purely sex, through sex. And so, how can you know that somebody has this sexually transmitted infection? An example is the common is syphilis and the gonorrhea. Of course, we have other examples like the trichomatis. Yes.
In Kiswahili, the syphilis and gonorrhea ni kaswende na kisonono.
Yes, exactly.
That word ikitoka kwa daktari in the hospital, people will run from you. You learn from this and get the facts about these diseases.
Yes, we saying amesema kwa Kiswahili kisonono na kaswende.
Yeah.
The commonest infections ambazo tunapatana nazo kila wakati. So we are not going to say kwamba hizi zingine hazipo, zipo, but we want to deal with common things appear common. So these STIs we have mentioned, how can somebody get to have them? We've said in through sex, sexual intercourse. Just say you sleep with somebody, you have sexual contact with that person, and this person was positive of these infections, you get this transmission into your body.
Now that it's through sex, do gays and lesbians transmit this?
Yes, it is sex. And I want to make it clear kwamba sex can be in different types. It can be oral sex, that's sex. So once you do it orally, you say that's oral sex. Be sure you can transmit this infection. And it's basically transmitted through these sexual fluids. Yeah. The mode of transmission is these infections are majorly found in the fluids. So whether you do it orally, through the vagina, or the anal region, that's sex. So you get to transmit this infection.
Mwenye anafanya sex maybe oral or anal anaweza pata. Sasa huyo atainfectiwa wapi?
Yeah. Thank you. The basic thing here is, has the private part come into contact with any other part?
Okay.
For example, take an example of gays. The mode of sex in that relationship is purely anal sex.
Yeah.
It means a private part is coming into contact with the anal region.
Yeah.
In the other way. So that fluid that is contained has the infection. If it's syphilis, it's in this person. So once he gets to have sex, either this anal, oral, through the vaginal way, the spread is there. Whether you go do this oral sex, as long as there is that release of the fluids, sexual fluids, like for example in a man, say the semen, you'll have to have that infection.
Okay.
Yes.
So what are the symptoms?
So the commonest thing you need to understand is many will mistake STIs and the UTIs. The symptoms are more like similar because you remember these infections are affecting the private parts. But the difference, we said last time, the urinary tract infections, they affect the urinary system. But other times, these UTIs can complicate to cause these STIs. So when somebody has a sexually transmitted infection, he or she will complain of lower back pains, lower abdominal pains, yes, painful urination, vaginal discharge. So now here about the discharge, it's the one that makes it more different from the UTIs. It's more unlikely to find somebody with a UTI presenting with a discharge.
Okay.
But when somebody comes, he or she, say a male is coming to the hospital with a complaint of discharge, urethral discharge, high index of suspicion should be on about STIs. Before anything else, just query about issues of STIs. And this person will tell you how long has he had this discharge, what is the color of the discharge, and how does it occur. Some will tell you the discharge just happens, it stains the innerwears. Some will tell you the discharge is purulent and it flows. Yes, we have had a man who comes with a history of urethral discharge that he tells you it is flowing, that he cannot control the flow. It just flows like any other thing. You get? So what you do when somebody presents with a discharge, you take a swab. For the females, you do the normal HVS, high vaginal swab. That is a technique that you take a sample is taken of that discharge for lab testing, for microbiology and testing. And if it's a man, the same procedure, you take a swab of the same and go test in the lab. But we can also say if you have syphilis, it can also be found in blood. You can take blood and test.
Okay.
The normal thing, you see mothers come to the hospital during antenatal clinics or another person, we send you for the antenatal profile. You remember we have syphilis test there in the name of VDRL. It's just blood taken and tested for syphilis. It's necessarily not about discharge only.
So if one tests for syphilis or the STIs and he or she is positive, do you treat the person alone or with a partner?
Now in treatment of this STI, somebody has come, has presented with the complaints like lower back pains, lower abdominal pains, painful urination, and pyrethroderma, vaginal discharge. You've done ABCD, you've done the testing, and it has come out comba. If it's a female, the discharge contains gonococcal infection. It means this person is testing positive of gonorrhea.